We will be talking about Peplau's theory of interpersonal relations. Hildegard Peplau was born in 1909 in Pennsylvania. This is where the flu epidemic was pretty bad, so as a child, she had to grow up and watch the devastating effects that it had on surrounding families pertaining to the death and illness. For her education, she started out in Pottstown, Pennsylvania School of Nursing, and she graduated in 1931. She also got her bachelor's degree in interpersonal psychology at Bennington College in 1943, and she also got her PhD from Teachers College, Columbia University in 1953. After she graduated college, she started out as an Army nurse from 1943 to 1945. She created and taught the first graduate nursing students at Teachers College, and she also created the first graduate program for clinical specialists in psychiatric nursing at Rutgers University in 1954 to 1974. She also taught interpersonal concepts and interviewing techniques at summer workshops, and she was also an advisor in the World Health Organization. After retirement, she helped create the first graduate nursing program at the University of Leuven in Belgium. She also was a visiting professor at this program in 1975 to 1976. Peplau's theory is very nurse-patient relationship heavy. Um, it started as 4 phases. It was orientation, identification, working, and termination. She eventually revised it and merged orientation and identification into just orientation. So during orientation, the health problem has emerged and the need is felt and professional help is sought. During the working phase, the patient identifies those who can help and who cannot, and the nurse starts to explore the feelings of the patient. During termination, this is where the patient is let free and they adopt new goals for oneself. Um, Throughout this process, there are 6 nursing roles. The first one is teacher. This is where the nurse provides knowledge to the patient. Then there is resource. This is where information is given to understand the problem. Then there's counselor. This is where the nurse helps the patient recognize, face, and accept problems. Then there's leader. The nurse initiates and maintains group goals through interaction. Technical expert is where the nurse provides physical care using clinical skills. And lastly, there is surrogate. This is where the nurse may take the place of another. Um, there are 4 psychobiological experiences between the nurse and the patient. This is needs, frustration, conflict, and anxiety.
So Peplaw's theory, at its core, it highlights the nurse-patient relationship in just providing effective care. This aligns perfectly with my personal philosophy of nursing, and my philosophy prioritizes holistic care and just patient-centered relationships. I believe that nursing is about treating the whole person and not just their physical symptoms, but by considering every need that they may have, whether that's emotional, social, spiritual. But this view is directly reflected in Peplaw's theory, and she stresses the need for understanding the patient in their entirety. In her theory, the nurse doesn't just treat a diagnosis, but they understand the person behind the diagnosis, and they help guide them through a process of change and self-discovery. So, in addition to the nurse-patient relationship, communication is also a cornerstone in both Peplaw's theory and my own philosophy. In my view, effective communication builds trust and it encourages openness, which enables a deeper, more compassionate level of care. And just as Peplaw's theory focuses on the importance of therapeutic communication between a nurse and a patient, I believe that clear, honest, and empathetic dialogue is also essential for the well being of the patient and essential for healing. So, another point of alignment between Peplaw's theory and my philosophy is the belief in empowering the patient. Peplaw's model encourages nurses to help the patient gain autonomy in their care. I share this belief in patient empowerment where nurses act as the facilitators. So they guide the patients to take control over their own health and well being. So now let's look at how Peplaw's theory can be applied in a real clinical setting. So a great example of this is caring for a patient with a chronic illness. So in this scenario, Peplaw's theory can guide the nurse's actions through all the different phases of the nurse-patient relationship. So in the orientation phase, this is when a patient first comes in with a diagnosis. So the nurse will begin by building rapport and assessing the patient's understanding of their condition. So the the main key in this phase is just establishing trust. So this is something I consider to be essential to the patient's willingness to engage in their care. So the nurse's role here is to just listen to the patient's concerns, provide emotional support, and just help the patient understand what to expect moving forward. So, as the patient becomes more familiar with their condition, the nurse enters the identification phase. So, in this phase, the nurse just helps the patient identify their personal concerns and goals for managing their health. So, for example, the nurse might ask the patient about any fears or misconceptions, about their illness and, help them process these emotions. So, by guiding the patient through this phase, the nurse fosters a sense of collaboration, which helps the patient feel empowered and active in their care. The exploitation phase The exploitation phase is where Peplaw's theory truly aligns with my philosophy of patient empowerment. Uh, Here, the nurse supports the patient in using resources to improve their health. So, for example, for a diabetic patient, this might involve teaching the patient how to, monitor their blood glucose levels or just educate them on proper nutrition. So at this stage, the nurse isn't just telling the patient what to do, but encouraging them to take ownership of their health by actively allowing them to make decisions. So this is where the nurse patient relationship really transforms into a partnership. And so the patient starts to feel confident in managing their condition a little bit more independently. And finally, in the resolution phase, Peplaw's model just emphasizes the transition towards patient independence. In my philosophy, I see this as the point where the patient has acquired all the knowledge and confidence to manage their health on their own. The nurse's role is to gradually kind of step back and, of course, offer support as needed. But, just allowing the patient to take more responsibility. And so this phase is a perfect example of how Peplaw's theory just builds self management, which is a value that aligns strongly with my own belief in patient autonomy. So, the impact of Peplaw's theory in clinical practice. So the beauty of Peplaw's theory is that it just doesn't apply in one setting, but it's universally, applicable in all areas of nursing. So this process not only helps to improve patient outcomes, but it also strengthens the bond that the nurse and patient have. So it shifts nursing care from being just task focused to being relationship focused. So, in conclusion, Hildegard's Peplaw's interpersonal relations theory perfectly aligns with my own personal philosophy of nursing, especially, highlighting the importance of patient empowerment and just holistic care. And by applying Peplaw's theory in clinical practice, nurses can help patients build the skill and confidence to manage their health independently. And through this approach, not only patient outcomes are improved, but it also helps to create more meaningful connections that help patients thrive.